Hello guys, again this is Simple and Drill Isaac. Karibu sana to my channel. Leo nataka tuongelelee kuhusu how to prevent TB infection in our community or in our society. Usually tunasemaga ndio mtu the main symptoms that a person present with when you're having TB. One of them is usually cough that is persistent over a period of more than a week. But currently, we are saying every day that if you feel you are coughing, and even if it's one day and you are not comfortable with the cough, uh, that one is an alarm. You should be tested. Cough of any duration. The other thing, when you suspect you're having TB, is drenching night sweat. Drenching night sweat, in a layman's language, we say is when you sleep and then you wake up, you find yourself you have a lot of sweating in such a way that even your pants are sticking in your body. That one is not normal, especially if you are not used to sweating so much during the night that in such a way that your your night dresses stick to your body. The other one is significant weight loss. Maybe I was wearing maybe size 32, and now even my boxer, which is size 30, is not fitting me. That is a sign that I'm losing weight significantly, and I should be tested for TB. Now, one of the reasons, that's one of the reasons that you should be tested for TB. Now, for us to be able to prevent TB from in our community, one of the things is let's take our treatment for those who have been tested and started on treatment. Please make sure you have completed your treatment as prescribed by the clinician or nurse or any other healthcare worker you found in the facility. Complete your dose of treatment and get all the tests as required by your healthcare provider. For those who have contacts with or who have interacted with persons who are suffering from tuberculosis or those who are on treatment, please visit in a health facility, be tested for tuberculosis, and be started for TB preventive therapy, the TPT. It's there, it's available, and it's free of charge in government facilities and even private facilities that offer TB preventive therapy. It's usually free of charge, and you'll be able to take it. For adults, they take it weekly for 3 months. For children, they take it daily for 3 months. And with that, you'll be sure that you'll not be spreading TB in your society, and you'll not be the next victim who will be diagnosed with tuberculosis. The other thing, we need to have good ventilation for those who are living with persons who are suffering from tuberculosis. Do not discriminate them or stigmatize them. Give them ample time so that they can be able to take their treatment to completion. And always make sure that for those who are taking treatment for tuberculosis, have a let them live in a well ventilated room, place with ventilators, windows open, let the door be open so that at least the room can have a good circulation. For those who can be able to ambulate, let them during the day, let them stay outside and enjoy the cool environment. And with that, they will not be able to stay in a stuffed up place where they'll be emitting the bacteria, and the bacteria will be roaming around that house. So let them have ample time to be able to enjoy the outside environment, and let them go to bed when it's necessary, or when maybe it's evening and it's becoming a bit cold. That will help as they improve up. They even also feel better interacting with other people in the outdoor environment. The other thing, for those for those who are living with HIV, always make sure that you have been treated for latent TB infection or be given TB preventive therapy while you are being started on your ARVs. It will prevent you from progressing to active TB if at one given point you had the latent TB infection. With that, I think that's awesome, and that's a good advice for us. And let us continue educating the community, educate your friend, let your friend educate her friend, and let us spread the gospel so that we can be able to prevent TB infection and growth of TB infection or new incidences of TB infections in our community, and that our people may be able to live healthy. Remember that the TB drugs that you receive from the government free of charge, they come from taxpayers' money, and if we can be able to reduce the cost of, we can be able to prevent TB. We can reduce even the amount of, we can be able to reduce the amount of expenses incurred by the government in purchasing these drugs, and that will be a positive impact even to when it comes upon even the development of our health facilities and other places that are that money that is used to treat the next person can be directed to other things that can be able to help our society. Even the money can be directed to even educating the masses more on living healthy and better life. Thank you. And also the other thing that I forgot. So when you're living with person with TB infection, give them good diet and encourage them to be able to complete their treatment. Let them not be your babysitters when they're having active TB, so that we do not risk our under fives from getting a TB infection. And even for those under fives, they should be also be given TB preventive therapy to prevent them from progressing to TB infection. And I think with that, we'll be able to live a more healthy environment, and we'll be able to enjoy our life in a more better way. Thank you, and kindly remember to like, subscribe, and share. Let more people be able to know and get to know about this channel, Puma Health Solutions, or you can also call me Mkurugenzi Maish. I'm a daktari. Bye bye, and God bless you.